guys, how's it going? This is Dr. Chris Collier at Elite Chiropractic Performance. I want to kind of continue with our theme of the month on tension headaches, and today we're going to go over what I think is the biggest cause of routine tension headaches, and that's what we call temporomandibular dysfunction, or TMD for short. Now, I'll point this out. I get this a lot where patients come in, they say they have TMJ, which we all do. That's just the name of the joint. So the temporomandibular joint, or TMJ for short, we have them on both sides. So the TMD, or the dysfunction of that, is basically when we do things that increase tension in the jaw or the neck, things like clenching or grinding, or other things like what are termed parafunctional habits, so biting of nails, chewing on pens, playing with hair, just things we do with our hands and our face that aren't really necessary that can lead to more tension. So like I said, TMD, I find this is the biggest reason for tension headaches, and it's actually a very, very common reason for neck pain in general. So you may not have any pain in your jaw, you may not even have headaches, but you can have TMD, which is contributing to neck pain. So usually when someone comes in with neck pain and or headaches, we're always looking at the jaw to make sure things are functioning properly. So we're going to go over just a quick little treatment session that I would do for somebody as far as TMJ stuff is concerned, and then maybe dive into what people can do on their own, maybe in this video or in other videos. We'll see how it shakes out. So I have Sarah here. So we treated Sarah, on and off for a while, and initially part of the complaint was we're unrelenting, or I guess that's a tough word, but a persistent tension headache. So we did find some issues with the jaw in itself. And so what I do when I initially evaluate somebody with this is I first have them lay with their head in neutral here, and then I'll look at them as they open and close the jaw. So first thing, let's go ahead and just open as far as you can, and then close, and then open and close. So if you kind of look in through here, as she opens, it's a little bit of the jaw swinging to the right, and then as she closes, it kind of recorrects and fixates itself. That can happen for a lot of reasons, one of them being tightness of certain muscles on certain sides of the jaw. They kind of pull you in different ways like that. Another reason that can happen is that the joint itself is really tight. So first I start noting, okay, what do they do with opening and closing? And then one other thing is I get her head in neutral. Go ahead and open as far as you can. As far as you can. You'll start to see her extend her neck. So basically super common, but as we open our jaw as far as we can, we're recruiting all of our suboccipital muscles in our neck. So that's where you definitely start seeing the play of neck pain and headaches kind of colliding together. So after I do that, I'll come in, I'll start to palpate the joint itself and go ahead and open and close and open and close. So I'm looking for a couple things. I'm trying to feel, is there any popping or clicking? So if you do feel that in your jaw, that's the disc that's in the TMJ. It's not staying where it should. And so we're looking for popping or clicking. I'm also trying to feel, go ahead and open and close. I'm trying to feel if one side moves too much or not enough. And open. And so with Sarah, I kind of feel, let's go ahead and open. I feel like the left side moves too much. So my fingers are under here, and as she opens, I feel the bone just kind of really jump out at me. So it's not the point of this video here, but sometimes people's jaw is dysfunctional, not because it's super tight, but it's too mobile. And we have to do different strategies to fix that. And let's do this one more time and open. And then if anything, maybe the right side just a little bit stuck. One common test that I do, or I have a patient do, is called the 3-knuckle test. So we take 3 knuckles, we stack them vertically like this, and we open our jaw as far as they can, and we try to insert it in there. Okay, so go ahead and try that. And so she's kind of, sometimes she easily can do it, sometimes it's a little limited. Go ahead and relax there. Now I'll find if you have any TMJ issues, and you can do that, it's probably because you're one of the people that open too much. You're cheating to get that kind of range of motion. Typically though, if we can't quite open to that amount, that can be because of tightness in all the muscles that contribute to that. So it's akin to, you know, a very general sense of I can't bend down, touch my toes because my hamstrings are tight. Well, I can't open my jaw as far as I can because certain muscles like this guy, the masseter, and your temporalis muscles are there. So these guys, in addition to some of the neck muscles, will refer pain to different areas. So if you have pain over the eye in a candy cane fashion, a lot of these are in play, across the forehead, across the back. So don't always assume things are don't always assume things are sinus related. I get that a lot. I think a lot of our headaches are tension based. So now that we have an understanding of what we got going on here, I start to work in various types of treatments. So my favorite thing to do for TMJ dysfunction is what we call post-isometric relaxation, or PIR for short. And that's just using the neurology to help stretch the jaw and to improve range of motion. The reason why I love it so much is because I can teach you how to do it on your own. And that's the beauty about a lot of TMJ stuff, is that you can self-treat yourself with almost the same efficacy as when we're doing it by hand here. So this is where the patient starts to get a little freaked out. I got the rubber glove on, they're like, what's gonna happen? So basically I stabilize the forehead, and I for the most part, it's just my thumb and the inside of the mouth, and then we're doing just sets and reps of contracting and relaxing, okay? So it's been a while since we've done this, Sarah, but you know the drill here. So I'm gonna stabilize here. We're gonna open as far as you can. Good, and I take thumb through here, and all I do is I take her to the first barrier that I'll feel. And do you already feel a stretch with this? Yeah. So I kind of hang out here. We do a lot of breathing work in the office as well, especially if you have headaches. And so I just tell them to focus on relaxing their body and relaxing their midsection so that they can breathe with their diaphragm. So now, once I get to a good point, I'll have her very lightly close her jaw, and I'm resisting that movement. So now I'm activating the muscles of the jaw for about 5 seconds, and then go ahead and relax. After 5, then I take it a little further, and then we hold. So we're just reaching new barriers as we go. How does it feel being on camera with like a fish hook in your mouth? And so sometimes the patient, they don't even know it, but they're really trying to close their mouth because it's an unnormal or unnatural feeling of having it stretched. But the more we do it, the better it does. So go ahead and let's close a little bit. And then relax. So I take it a little further. Oops. Typically this doesn't hurt. It can be intense depending on the person. I know when I have it done, it's intense, but I have an issue with clenching. Some they really like it because it feels good. The only pain that comes out of this is my right thumb digging into their teeth. That's it. So if you feel sorry for me, then I appreciate that. So go ahead, bite down again. And then relax. So go a little further. So we usually want to make good changes, not just in how they feel, but how much they can move and open their jaw. And we look for about, it depends, but like 5 to 7 millimeter changes, which I'm not really measuring these with a ruler or anything, but we just kind of look at the motion and we take it from there. Good. So we'll take a break there. So I might go back and do another round of that. Maybe I do more within the one round. Other things I can do, so I mentioned the right side felt a little bit more restricted. So I come in here, so go ahead and open. I just slide my thumb in, and basically I'm just giving it a little bit of traction, and I'm oscillating. It's just mobilizing. The TMJ is not a joint that I thrust on or I like adjust in the typical sense. I just mobilize. Go ahead and relax your jaw here. And so I'm just kind of pulling it apart. Sometimes I'll do this little earthquake type motion. I'm just trying to budge it into a different direction here. Good. And relax. Other thing I mentioned, or I didn't mention, when I'm watching it open, go ahead and open and close. Open. So she doesn't have it, but commonly as people open, they push the jaw out. And so if that's the case, what I do for that, is I do the same thing as the opening and closing, but I start to work, I'm pushing it straight back. So I'm just gonna lightly do it here, open a little bit, relax, and then I push down. And then after a little bit, now I'm gonna have her push her chin in, and then relax. And so we just go back and forth with that. There's other things I can do with muscles in the mouth, but it's all just about pressure and movement. There's no quick thrusting or forceful stuff with this. We want to be careful with that. Other stuff that I'll do is I'll come onto the muscles themselves. So muscles you're going to really find a lot of issues with are here, which is your masseter, which is your big clenching muscle, and then through here, your temporalis. And so these muscles are known to have trigger points in various areas. And so what I do a lot with this is more pin and stretch. So I kind of pin and hold, go ahead and open the jaw as far as you can. Good, and then relax and open. So obviously you can easily do this on your own by using your own hands. I drag away and then I open as far as I can. Same thing through here, open and close, open, close. So it's adding pin and stretch. You can also just do basic trigger point work through here like this. So I work around. Good. So that's, one type of treatment for TMJ. Now, if you have headaches, you owe it to yourself to have this looked at. I find that it's overwhelmingly common. And if you don't have headaches, if you just have neck pain or you're tense, you have stiffness, absolutely got to look at this. And this is where we take people that have headaches almost every day of their lives, and literally they have no headaches, and it changes their lives. And I feel like we don't have to live with headaches. And for a lot of people, when they come in here, they're not coming here specifically for headaches. They're mentioning other problems, and we're just looking at it like, are you sure you don't have a headache issue? And then they finally realize, I think I do, it's just normal, I live with it. And so the big goal with this is we not only can improve neck pain and headaches with this, but the quality of life, the tension that's released from your head, it's unbelievable. And it's an easy thing for you to do on your own to kind of pick it up with maintenance type of deal. So a little bit there, so I did a little bit with the jaw. There's other stuff I can do for it, but for her, this is what I like to do. And then I'll work some cervical spine, some neck treatments, we'll adjust her. And in addition to this, we're working rehab to fix breathing, to work on posture. When everything falls into place and everybody's doing their job, me and the patient included, the only thing I'm gonna settle for is no headaches, no neck pain. So if you got questions on this, let me know. I feel like everybody's owed to get this looked at some point in their life. But look for more things in the future pertaining to this type of condition and how we can help. Thank you.